Hi, I'm Josh, Managing Director of CareLineLive, and I've got here with me today one of my customers, Busi, who's going to talk to you about CareLineLive and how it works for her. Hi Busi, could you tell us a little bit about yourself and your home care company?
I'm the Managing Director for Home Care Nurses Australia. My background is I'm a registered nurse by trade with 20 years experience. Home Care Nurses Australia started 7 years ago as a hobby, but it's become more than a hobby. We've got 200 care workers currently working for us. We're in the disability sector, specializing in supported independent living. We also do labor hire, supporting other organizations with nursing care, disability support work, domestic assistance, including therapeutic services. We also do home care packages.
What were your main reasons for choosing CareLineLive?
Main reason for choosing CareLineLive was the fact that we work remotely, and I needed something that I could view what was happening on the field remotely. It allows us to intervene when carers have got concerns. You can also use the app to take photos, and so when we do nursing care and wound dressings, someone experienced is able to review from our end. It saves time, very cost effective, and there's always constant communication between the managers, the carers, and also the families, so everybody knows exactly what's happening, and we can just log in, look in the system, and see what has taken place and what hasn't.
How does CareLineLive work?
CareLineLive has got 3 different platforms. It's got the management platform, it's got the carers platform, and then it's got the family portal. So with CareLineLive works for us efficiently. We use different platforms. So I'll start with the management platform, where we use the rostering section. We used to have issues with people rostering people for long hours, like 16 hours. CareLineLive managed to improve that, because you can actually see the number of hours that the employee has been rostered. And then you can also tell whether the travel time between clients, because that's another major issue. Sometimes people are rostering, they don't know where they're going. It actually shows you whether if they use public transport. It gets to show you how long it's going to take them to get there during public transport, which I think is very cool. You can run also a continuity report on the clients. You can also run punctuality reports, which we use as part of our performance review. The ability to track the carers to make sure that they've clocked in, and then they've got a QR code which you can use, and you can put it into the client's house, so the carer will only be able to clock in when they've arrived at the house, and they cannot clock in remotely, which we also found very useful, because we've had incidences where some carers have clocked in and then we have not got the alert, and the client is not able to notify the office that the carer has not attended. But if you know those high-risk clients, then the option of using the QR code is fantastic. On the carers app, what I like is they can see the date of birth. You can put in rota tasks in there, what's relevant, whether the client is aggressive, whether they need to see the key code, how to enter the house. Now the carers can see when the previous medications was administered, which is fantastic, because if they are requesting PRNs, they can tell whether the previous carer had administered a PRN medication prior to authorization. We've got the client portal. We only use the rostering side of things, where the client can see the times the carers will be attending, and also the carer that will be attending shift. And if they have any concerns, then they can notify the office immediately. So we're proving to be a little bit more efficient, reduces admin work, and we also use it for documentation, for documenting what the carer has done in the client homes. We also use it to store our documents, so from allied health, from the hospital, from the GP, you can actually put it into the client profile.
How did the onboarding and training process work?
The onboarding process was very simple. I'm not an IT person. I like things that are very simple, straight to the point. It was really good. We wanted to move all our clients within a short space of time, which we managed to do. The training stuff was easy. We've just done an easy video. Everything is so simple. It's in your face as long as you can use. Everyone is using smartphones these days. So it's just either sliding or scrolling up and everything, the information is there.
Were there any challenges in setting up the system?
I guess with any IT system, there's always going to be challenges. The most important thing, I guess, is the response from the IT team, which we're quite impressed. They were readily available and they're very responsive.
What are the main benefits to your carers and to your managers?
The main benefits to managers and carers is that real-time documentation that you can see. It's in your face. There's no excuse that you're not aware of anything that was happening. It's all documented. We've got very complex clients and we have to report numerous times. We also get positive behavior plans which need to be implemented, so we can actually dissect that information, run reports specific. I love the photo taking just because we can see before medications are given and after. It has reduced the number of errors happening with medication administration. We can, when we receive a call from the office, if there's been a complaint or something has happened, the coordinators just go into the file, read the employee's report, so they sort of have an idea of what has actually happened at the time of the incident, which makes it a little bit easier to solve problems or to follow up. Administration, I hate filing, so we are paperless. That's one of the things that I'm very happy about, the fact that we don't have to file anything. In the system, what I like in the management portal is the carers don't have to see all the documents. You actually tick carer up and they only see what's relevant to the client. But now, because we actually tick which document they need to see, we're finding more people enthusiastic and actually reading the relevant information. So it has also improved the care we provide for our clients.
CareLineLive also offers EMR, or Electronic Medicine Administration records. How does this work and help your business?
EMR is important to us because we use it for our medication administration. So in the office, the registered nurse is the one that actually adds the medication onto that medication chart, verifying with the pharmacy document and the doctor. And then it gives instructions on how the carer has to perform the task. The part I like about the EMR chart is the fact that you can run a report from the office. So you can run a report at any time to see whether the carers have administered the medications. It gives you different options: left out, refused, prompted, self-administered, or completed. And it also allows you to write a small comment, what has actually taken place. So when you run the report, you can tick include completions, and you're able to see how many PRNs have been given in a month. Previously, we had to go through notes, which was very time consuming, but running this report, it's more accurate and you can use that as your supporting document. We also use it to see whether the clients are being compliant with the medication. it has been an important tool in our stakeholder meetings because we can tell them within a month the client has only taken their medication 4 times, which is obvious that the client is non-compliant. That's how we use the EMA chart.
EMA is really simple to set up. It only takes a couple of seconds when adding it to each of your clients. You can then easily run reports to make sure that your carers have been administering the right medication and that there's no safeguarding concerns that you need to be aware of. How do you use CareLineLive for auditing and reporting?
On a monthly basis, CareLineLive teams send us a report as evidence on their part that they're running, having a look whether there have been any data breaches, which I find very useful for our auditing processes.
CareLineLive store all data securely in the Amazon Web Services data center in Sydney. It's regularly backed up, with penetration tests being run regularly also, to make sure that nobody can hack into our customers' environments. We also keep a full audit log of every login attempt and every successful login as well, so we can make sure that only the right people are accessing CareLineLive. How do you communicate about the care you provide to the family of a loved one?
We mainly use the family portal. If an employee calls in sick and we have to change the support worker, the client receives it in real time. So it has stopped us from actually having to go into the management system and send in a PDF. It happens in real time. If the family member is not happy with a care worker and they've been rostered, they're also able to bring it to our attention in a timely manner. And they're also aware of the time that will be attained in shift. If they have any issues, then they'll notify the office immediately.
Thank you for your time today, Busi, and everybody else for watching. I hope you found it useful and informative. If you'd like to find out more about how CareLineLive can help your business, then feel free to get in touch and we'll provide a demonstration for you. If you would like to see how CareLineLive works, please keep watching for a short explainer video.
CareLineLive is an award-winning total care management system for home care agencies. It reduces administration and automates processes. It improves efficiency, giving you more time to care for your business, your staff and your clients. It's a cloud-based system, so you don't need any expensive hardware and can run your business from anywhere. Save time by rostering recurring visits once and make booking changes easily using our drag and drop functionality. Carers are directly informed in real time as soon as rosters are updated. Our Carer Companion app helps carers be more efficient and results in less errors. QR codes allow for easy visit check-in and check-out, ensuring all visits are recorded accurately. Carers have easy access to care plans, client and booking information. They get more time to care. Client safety is increased as our EMA solution reduces errors in administering medication. With real-time rota access, carers always know where their next visit is. Call monitoring allows office managers to know in real time when a visit has been completed. Plus, location awareness increases carer safety. Our Family and Friends portal allows families to keep up to date with their loved one's care. With CareLineLive, invoicing and payroll is quick and easy. Plus, our friendly support team are always on hand to help. Choosing CareLineLive gives you all the tools you need to run your home care agency more efficiently, giving you more time to care for your business, your staff and your clients. To learn more or to book a demo, visit carelinelive.com.au or call 03 8518 4374.